With all that pain tonight, we wanted to take a closer look at South Korea because it is considered the gold standard. The rate of new cases there peaked late last month and are still under 10,000. Fewer than 160 people have died. Tonight, Aimee reports on how South Korea slowed the spread.
In South Korea's war against the coronavirus, there's been no shortage of personal protective gear, and just 121 healthcare workers have fallen sick in the whole country, versus more than 200 in Boston alone. For patients, there's been a bed and ventilator for everyone. Test, trace, treat has been South Korea's mantra.
The MERS outbreak of 2015 gave them some experience with, how things can go wrong.
Dr. Jerome Kim says that past epidemic guided future planning, allowing for tracing and identification.
The system for letting people know that they might have been exposed, which is really remarkable. I mean, if you've been to the supermarket, between 10 and 10:15 on the following date, you might have been exposed.
Anyone quarantined must download an app that tracks their movement. Fines for violations run as high as $2,500. The strategy has worked. South Korea and the U.S. reported their first coronavirus cases the same day in January. More than 6 weeks later, South Korea tested 137,000 people, while the U.S. had tested nearly 1,000. A week later, the U.S. had tested 10,000, South Korea 235,000. With New York City now the U.S. epicenter, Kim says it's still not too late for the United States to follow South Korea's lead.
Decisiveness, transparency, clarity of messages, and testing and isolation made the response better.
Aimee, CBS News, Tokyo.
There's a lot we don't know about the novel coronavirus, but when we look at South Korea, we can notice ways we could have contained the spread without shutting down the economy. It's something the U.S. and other countries are still trying to learn.
South Korea learned from its past experience with the MERS outbreak in 2015, when the government was seen to have withheld information and been slow to provide testing, and it became a big embarrassment for the government at the time because it was the largest number of cases outside of Saudi Arabia.
South Korea discovered its first case of coronavirus on January 19th, the same day as the first case in the U.S.
So when it was just a matter of a dozen cases in South Korea, the government was already starting emergency procedures to get companies producing test kits for the novel coronavirus and cutting a lot of the bureaucratic processes that typically have to take place for such tests.
Within 2 weeks, thousands of test kits were shipping daily. If someone tested positive, health workers would retrace the patient's recent movements, a process known as contact tracing.
When you have a case, you contact 10 people. You ask them, who did you meet with in the last 5 days? If you get a list of, say, 10 people, then you contact those 10 people. It's very labor intensive when done thoroughly. But the South Koreans were set up for this, and they had lots and lots of tests.
The large-scale availability of testing has really meant that South Korea was able to widely test people who didn't have a travel history to China, who didn't have symptoms, that allowed the country to discover a lot of cases of people who were asymptomatic.
South Korea was also more efficient in getting out important information.
As the coronavirus cases were surging in South Korea, we began starting to get emergency alerts like this to our cell phones, telling us about each and every coronavirus case. If a case had occurred in our proximity, we would know about it, and it would also give us detailed information about, say, if person A had traveled from this grocery store to this subway station to this specific number of bus at these particular hours. Another thing South Korea has done is to separate out the people with mild symptoms into residential facilities so that they could be away from their families and away from their communities, but also not overburden hospitals.
The country has introduced drive-through coronavirus testing, and even a phone booth-style facility where medical staff can examine patients and do a nasal swab test. Many restaurants check people's temperatures before they enter. Hotels, offices, and large buildings have thermal image cameras to check if people have fevers, taking the burden off of hospitals.
South Korea listened to their experts, and they mobilized quickly with a sense of urgency. In the United States, our president was still doubting that it was actually going to be a problem, and there was consistently mixed messages.
The U.S.'s weak response has created a shortage of tests. The strain falls on health workers who continue to combat the disease with limited supplies and an inability to track the spread.
Meanwhile, this has also been at the forefront globally, the whole issue of what South Korea has done. South Korea has done better than most of the other countries around the world in handling the pandemic. They are now sending 600,000 more COVID-19 test kits to the U.S. today. South Korea's widespread testing has allowed it to become the first country to hold a nationwide election during the pandemic, a possible blueprint for the U.S. in November. What lessons can the U.S. learn from South Korea's approach to the virus? NBC Korean Affairs analyst Victor Cha has some answers. Victor served on the National Security Council, leading all of our government efforts on North and South Korea for years. Victor, good to see you. Let's talk about this election, which apparently was held successfully. We've seen video of people going to the polls, getting their temperatures taken before they can vote. Everyone wearing masks, of course. What can we learn from South Korea and how effectively they broadly tested, and are beginning to reopen?
Well, I think you just said it there, Andrea. I mean, one of the things they did was they did widespread testing. So they've tested 2 to 3 more people per capita in South Korea than they have here in the United States. And they, as you mentioned in your piece, they have a surplus of masks and test kits that they're now exporting abroad because they've met all the domestic demand. And they never really had to lock down and shut down like we're doing now because they moved fairly early. Basically, right after the crisis, almost right after the crisis, they declared a national emergency about a month before the United States did. And then within 2 weeks of their first case, they discovered their first case within a day of the United States discovering their first case. Within 2 weeks, they were rolling test kits off the production line. And within 3 weeks, they were creating these phone apps for mobile contact tracing. So, they learned from previous mistakes. They had pandemics before where the government didn't respond well. And so they were quite prepared this time, and the results are clear.
Now, their phone apps are probably similar to what Apple and Google are talking about with phone-to-phone connections, but there are privacy concerns. You worked in the White House. Do you think that the U.S. would accept that and could properly protect against the privacy invasion that this could represent?
Yeah, I mean, it's a great question. Undeniably, these sort of locator apps do raise privacy issues. They raise privacy issues in the United States. There was one Trump official that said Korea can do this because they're not a democracy. But this is a country where the people actually impeached the last president of the country. So they're very much a democracy. But there are clearly our privacy concerns with something like this. But it's a trade-off. On the one hand, these mobile apps and this mobile tracing provides a public good so that we all feel safer and more comfortable going out of our homes if we were to reopen our economy. And that's the key. The objective is to reopen after the peak. And if we don't have universal testing, right, as Debbie Dingell just said, and we don't have a vaccine, which is 18 months to 2 years away, all we're left with is contact tracing and social distancing. And so what these phone apps do is they give us a better handle on being able to do that, even though it means a temporary incursion of our privacy.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.
This graph shows the number of daily reported cases of COVID-19 for 10 countries. While some countries have been able to flatten the curve, others have seen exponential growth. Even when adjusted for population, some of these curves look very different. Reports have attributed these differences to 3 key factors: isolating cases, testing, and tracing cases. So, to better understand how each measure affects the curve, we decided to compare these 4 countries and their different responses. Why does South Korea have a bell curve while the US has a steep slope? Let's zoom in, starting with China, the first country to be hit by the virus. Here's China's curve, but the crisis started well before these numbers peaked. On December 31st, China reported to the World Health Organization that it was treating dozens of cases of pneumonia. A week later, a new type of coronavirus was identified, and the genome was mapped. Later that month, China isolated Wuhan, the city where the virus is thought to have originated. A lockdown was then expanded to 36 million people. And during that time, China was building emergency hospitals and developing a rapid testing kit. By mid-February, over 700 million people were placed under travel restrictions or quarantine. And by the end of March, China had conducted over 320,000 coronavirus tests and had attempted to trace each of the 80,000 plus cases. After a large outbreak, it was able to flatten the curve, to the point where earlier this month, China reopened Wuhan, over 10 weeks after the lockdown started and over 13 weeks after the first cases were reported. Its curve is unique though, because it was the first country to deal with the virus, and the lack of public information and measures early on allowed the virus to spread. The eventual lockdown measures it took were particularly drastic, but in the meantime, the virus spread to other countries. One country in particular has a curve that looks different than most. South Korea started developing COVID-19 tests before its first confirmed case. The country had put procedures in place for managing an outbreak after dealing with MERS in 2015. And it had a testing methodology ready even before the new coronavirus was identified. By early February, South Korea's first test had been approved, and it used extensive contact tracing to identify the travel of each confirmed case, down to details like a person's seat number or what stop they got off the bus at. The data was anonymously posted online, so people could check if they came in contact with a confirmed case. This became an important part of its strategy. Not only was it testing aggressively, but it was also contact tracing. Anyone who was thought to be infected could then be tested and isolated. A month later, cases peaked, but over 100,000 people had already been tested. By late March, South Korea had tested 3 times that. And a social distancing order banned large gatherings, further slowing the spread of the virus. Some experts say that by developing broad testing and contact tracing measures before its number of cases spiked, South Korea was able to flatten the curve. The country is still reporting new cases, but compared to the over 900 daily cases during its peak, the outbreak is much more manageable. And social distancing measures are still in place, further limiting the spread of the virus. Let's look at Germany next. It had a test ready by mid-January. 4 days later, Germany had its first confirmed case. It was able to start manufacturing tests by early February, allowing it to test about 120,000 people per week by early March. And it implemented several social distancing measures later that month, closing schools, borders, and banning gatherings of more than 2 people. By late March, Germany was testing over 300,000 people per week. As of April 8th, Germany had tested more people than any other European country. This is due in part to its early testing and its use of contact tracing, which allowed testing to identify even the mildest cases of COVID-19. But case numbers have been high. As of April 10th, Germany had the 5th highest number of COVID-19 cases, but it has one of the lowest fatality rates in the world. Some experts think that Germany's expansive testing has kept the fatality rate so low. But not every country was able to start testing early. The US currently has the highest number of confirmed COVID-19 cases in the world. Its first case was confirmed on January 21st. And while we don't start to see a spike until March, that doesn't mean there weren't cases before that. They likely went undetected due to a lack of testing. According to the Associated Press, US government labs processed only 352 COVID-19 tests in all of February. Testing only ramped up in early March, when the CDC started to allow private companies to develop their own tests. But for a while, tests were only available for people who had traveled from China, or had a fever severe enough to be hospitalized. And the lack of contact tracing, quarantine, or physical distancing measures exacerbated the spread. By March 11th, over 100 colleges had canceled in-person classes. But major social distancing steps didn't take place until mid to late March. Almost 2 months after its first case, a national emergency was declared. The White House and the CDC advised against large gatherings, and states like California and New York issued stay-at-home orders. But by then, the US was already seeing over 10,000 cases per day. Now, over 40 states have stay-at-home orders in place. But the US has been criticized for not implementing preventative measures early. It was slow to gather resources while the virus was spreading to other countries. And a botched rollout meant that testing didn't start to expand until mid-March. With little testing and hardly any contact tracing, the virus was able to spread silently throughout the country. The US is now testing over 100,000 people per day. But as of April 13th, the US still had fewer tests per 1,000 people than South Korea. An earlier start in identifying and isolating cases could have prevented such a large outbreak. In many countries, it's not just one measure that flattens the curve. It's the combination of isolating, testing, and tracing. Countries that have been able to do all three swiftly have been able to lower their number of new cases. But those that haven't will likely take longer to flatten the curve.
To see how well South Korea is handling this outbreak, have a look at the lineups of passengers arriving at Incheon Airport near Seoul. They have to pass through multiple levels of temperature monitoring and fever checks. There are testing facilities right in the airport. Passengers are told to self-isolate for 14 days. They are required to download a cell phone app to report any symptoms to health authorities, in which case they will be closely monitored. This is just the first line of defense in a massive system to track the virus, and it seems to be working. If you compare the progression of infections in countries like Italy, Spain, the United States, and Canada, Korea was much more successful in containing the spread of the disease, and now has far fewer deaths per million of residents than most infected countries. It didn't start out so well. Back in February, in a religious sect called the Shincheonji Church of Jesus in the southern city of Daegu, a woman now called Patient 31 ignored symptoms of COVID-19 and proceeded to attend large religious ceremonies. By the time she was diagnosed, this super spreader had infected over 5,000 people. Then the secretive church refused to cooperate with medical investigations. Young Sun Kim is a journalist with KBS, the Korean public broadcaster.
This church keeps their followers' identity secret. And initially, they were reluctant to hand over the list of their followers to the authority. That's why, the Korean people were so mad at this church.
Eventually, the church leader prostrated himself before an angry public and apologized profusely. The Korean containment system swung into action to slow the outbreak. Once it is established that someone has a suspected or confirmed case of COVID-19, cell phone and credit card data is used to chart everywhere that person has been lately and every other person they have come close to. The contacts of those people can also be traced almost instantly, giving a much better idea who requires immediate testing. Hoon Sang Lee is a professor of global health security at Yonsei University in Seoul.
They can use big data and AI to analyze their whereabouts. So now it is totally automated. So within 10 minutes, all those information can be gathered automatically. So the contact tracing time had been drastically reduced at this moment.
People also receive cell phone alerts of contacts with infected patients and locations in their neighborhood. Victoria Kim covers South Korea for the Los Angeles Times.
So if there's been a COVID patient in my vicinity, I will get an emergency push alert on my phone that'll tell me they were at this restaurant between the hours of 7:30 and 8:30 last night, or like this particular subway stop at these hours.
This sort of thing will raise privacy and civil rights concerns around the world, but the vast majority of Koreans seem to accept it.
The government keeps the balance between protecting public safety and protecting private information, basically. So the information made to public does not include any private information that allow people to identify whose information they are receiving. So it only says male or female and their age. That's all. So you cannot tell who he or she is actually. And second, the people understand extraordinary measures are necessary during extraordinary time.
Drive-in testing facilities have been set up all over the country and are a godsend for families who can't bring in babysitters or spend hours in the hospital. Robert Kelly is an American professor at Busan University who became famous a few years ago when a BBC interview with him was interrupted by his children and then his wife chasing them, and the viral video of it went around the world. He loves Korea's drive-in testing facilities.
Taking my kids to a hospital for 2 or 3 hours? Give me a break, right? I mean, forget it. They're going to be climbing the walls and punching each other, and they're going to tear stuff off the walls. I don't know. You literally just sort of pull up into like a parking lot somewhere of a government building or a school or something like that, and you'd wait your turn, and you don't even have to get out of the car, and the guy comes up and they swab your nose or your throat, right? And then they take the biological stuff and go and they do the test and they come back in about 15 or 20 minutes.
Professor Kelly is impressed by the Korean public's cooperation and compliance with outbreak guidelines.
Korea is very centralized and it's very presidentialized, which means once the presidential office decided that this was a big deal and moved against it, the Korean state was able to swing into action pretty rapidly. But the level of social compliance with government recommendations has been very, very high.
Unlike many other countries, there seems to be no huge pressure in Korea to quickly reopen the schools. Bars and restaurants were never closed. South Korea has shown the world that very extensive testing and contact tracing are the most important weapons against this pandemic, lessons that few Western countries seem to have taken to heart. Terence McKenna, CBC News, Toronto.